All right, today we're going to unpack the science behind a really fascinating peptide called tesamorelin. We're going to look at how it works, its kind of surprising origin story, and what the clinical research is telling us about its powerful effects on the body. So, let's just get started. So, let me ask you a question. What if you could specifically go after the most dangerous type of fat in your body? You know, the kind you can't even see, the kind that quietly wraps itself around your vital organs? Well, that's not just some hypothetical question. It's the exact challenge that led to the creation of tesamorelin. To really get what tesamorelin is all about, we've got to start with the problem it was built to solve, this hidden danger that is visceral fat. Now, this isn't the fat you can pinch. We're talking about visceral adipose tissue, or VAT. It's that hidden fat stored deep, deep inside your abdomen, and its location is exactly what makes it so dangerous. I mean, it's surrounding your liver, your pancreas, your intestines, and it becomes metabolically active in a really harmful way, creating a direct line to some very serious health risks. And this brings us to where it all started. Back in 2010, the FDA gave tesamorelin the green light, but for a very specific group, HIV patients dealing with something called lipodystrophy. See, their life-saving treatments were causing a dangerous buildup of this exact type of visceral fat. So tesamorelin was developed to tackle that very specific, very serious medical need.
So how does this stuff actually work? Well, this is where the science gets really, really cool. Because tesamorelin doesn't just jam something new into your system, it unlocks a process your body already knows how to do.
So what is it exactly? Well, tesamorelin is basically a synthetic copy of something your body makes naturally, growth hormone releasing hormone, or GHRH. It's a very carefully designed peptide that mimics your natural GHRH, but it's got this clever little tweak that lets it hang around in the body longer. And this is the most important part, it is not growth hormone. This visual right here makes the difference totally clear. Think of your growth hormone system like a highway. Injecting direct GH is like just jamming a flood of extra cars onto the road all at once. Chaos, right? Tesamorelin is completely different. It's more like a green light. It simply signals your pituitary gland to release its own natural supply of GH, the way it's supposed to, in these gentle pulses. And that is so key, because it keeps the body's delicate feedback system intact. So here's how it all goes down. Step 1. Tesamorelin binds to the receptors on your pituitary gland, perfectly tricking it into thinking it's your natural GHRH. Step 2. This signal tells the pituitary, hey, time to make and release our own growth hormone. And then step 3, that natural GH gets into your system, raises your IGF-1 levels, and kicks off all the powerful metabolic effects that we're about to get into. So what happens when this natural process gets a little boost? Let's look at the real, science-backed benefits that researchers have seen in clinical trials. Okay, the main result from the clinical trials is pretty amazing. Over a full year, patients saw a sustained 18% drop in that dangerous visceral fat. And this wasn't some quick, temporary thing. It was a significant, lasting reduction that went right after the core problem. And the benefits don't just stop there. In patients with non-alcoholic fatty liver disease, get this, researchers saw a 37% relative reduction in liver fat after 12 months. That is huge. It shows that the impact goes deep, right into the health of your organs. But wait, there's more. Beyond just fat reduction, the research points to a whole range of other positive effects. We're seeing it can improve muscle composition, upping both density and area. It also leads to a much better lipid profile, dropping triglycerides way down. And some of the most exciting new research is even suggesting it might help enhance cognitive function in older adults.
All right, with any powerful medicine, we have to look at the other side of the coin. A balanced view is absolutely crucial, so let's dive into the risks and the really important warnings. Looking at the real data from a clinical trial gives us a very clear picture. And what's interesting here is that some side effects, like bruising or joint pain, happened just as often in the placebo group. But things like stinging at the injection site, yeah, that was definitely more common with tesamorelin. It's also pretty notable that high blood sugar or hyperglycemia was almost identical between both groups.
So to sum it up, the most common side effects are pretty much what you'd expect from something that works with your growth hormone system. You've got injection site reactions, redness, itching, that kind of thing at the top of the list. Then there's joint and muscle pain, a bit of fluid retention, and sometimes a tingling or numbness. Okay, now for the biggest, most serious warning, and this is pulled directly from the official FDA label. Because tesamorelin stimulates growth factors, it is an absolute no-go for anyone with an active cancer. This is, without a doubt, the most critical safety rule you need to know. And there are a few other critical warnings to pay attention to. First, it raises IGF-1 levels, so that needs to be monitored by a doctor. Second, it can mess with your glucose metabolism, which increases the risk for diabetes. Allergic reactions are possible, of course. And finally, it is absolutely forbidden during pregnancy as it could harm the fetus. Okay, so we've covered the science and the safety. Now let's get down to the practical stuff. How is tesamorelin actually used? The standard way to do it is to start with a lower dose, just 1 milligram for that first week. This is a really important step to see how your body handles it. If everything's good, then you bump up to the standard 2 milligram dose every day after that. And this chart here breaks down exactly how those doses look in units on a typical syringe. You take it once a day through a subcutaneous injection. That just means right under the skin in your abdomen. And it is so important to rotate your injection sites every single day. That's to prevent irritation and make sure the medication is getting absorbed properly. So after all of this, the history, the cool mechanism, the really impressive benefits, and the serious risks, we're left with one huge question. Is tesamorelin really a game changer for our metabolic health? Here's the final takeaway. First, yes, tesamorelin is a powerful, clinically proven tool for getting rid of the most dangerous kinds of body fat. Second, and this is crucial, it's not a permanent fix. The benefits will reverse when you stop the treatment. And most importantly, this is not some casual supplement. It is a prescription drug with real risks that has to be managed by a qualified healthcare professional. It absolutely can be a game changer, but only when it's used the right way and safely. Thanks so much for tuning in.